Hi guys, I'm Dr. Renee and I'm an NHS doctor with special interest in women's health and menopause. So this is a subject after my own heart. And today, this is part one of my A to Z of menopause. What is menopause? Menopause is a sexual stage in a woman's life when her ovaries no longer have eggs. And so when no egg is produced in a month, a period doesn't come. And eventually, periods will stop altogether as eggs run out and stop altogether. And this is a permanent state, and it means that at this point, a woman can no longer get pregnant. Menopause is not a disease, but it is a life stage that can bring symptoms which can be debilitating and interfere dramatically with normal daily life, and it sometimes needs treatment for that reason. But having said this, it is a normal part of ageing for women, and it will happen to every single woman sooner or later. For most women in the UK, the average age of actual menopause is on average 51. That doesn't mean, however, that it arrives the night before you turn 51 and finishes the day after, if only. The time leading up to menopause is called the menopause transition period or perimenopause, which is more common. This can start as long as 10 years before periods actually stop. And in that time, you may have symptoms. They may come, they may go, they may slowly grow and get worse, they may become more permanent, and for some, they may come, then go, and never return. The message here is every single woman is unique, as is her journey and her approach, and hopefully that of her doctor, if she seeks a solution. So their approach should also be unique, understanding and flexible. Some women may even feel relieved when they no longer need to worry about periods or getting pregnant. For others, it's a difficult time to cope with mentally. It's the end of an era. It's the end of possibilities in terms of getting pregnant, although it isn't totally, but that's for another vlog. And of course, it's a reinforcement of ageing. It's important to remember that whilst the average age of menopause in the UK is 51, that's not actually the end of the story. Normal menopause is any woman over 45. If it happens between 40 and 45, it's considered early. However, we must not forget that there are women and even girls who start what is the equivalent of menopause earlier than 40. In fact, there are some teenagers that sadly go through it. Anything under 40 is called premature ovarian failure, and obviously the younger a woman is, the more devastating that diagnosis is from a fertility perspective, but also a health perspective, and I will cover the problems created by menopause, which is accentuated, of course, by how long you spend in it. And a 30-year-old spends more of their life in menopause and living without estrogen than one who started it at 50. So imagine you've reached that point where periods start to change. Again, no fixed pattern for this, but many women's periods start to get heavier and closer together. Then they start to get further apart and lighter. And eventually, when you've not had a period for 12 months, you are officially classified as menopausal. Hurrah! But as I mentioned, it's impossible to predict how it will go for you. Some women just stop having periods literally one day. That's it, no more, and it's over. Some women have erratic periods, 2 in 1 month, skip a couple of months, then another one, and so on, and they have no idea when the next one is coming. Some women go 11 months, think they're through it, and then suddenly they have a period. The thing is that the more predictable thing is the age that you will go through it. This tends to be very genetic. So if your mother went through it at 45, then it's likely that you will too. But there are even caveats to this. So things that can change this is when you started your periods. And you might have started earlier than your mother. Children are getting heavier nowadays and periods are starting earlier and then tend to finish earlier because we are born with a finite number of eggs in our ovaries. If you have medical treatment which affects your ovaries, such as radioactive iodine, which I had, chemotherapy, if you have pelvic problems, if you've had a hysterectomy or an oophorectomy, all of these things plus genetics play a role. So genetics is then only a guide. Other factors such as race, ethnicity, culture, lifestyle, environment also play a role. For example, smoking is actually associated with an earlier onset of menopause and more severe menopausal symptoms. Black women are more likely than white women to have an early onset of menopause. and experience more menopausal symptoms and for longer. But Asian women are less likely to suffer from menopausal symptoms. Or is it culture that means they don't talk about it? And just because your mum didn't get any symptoms, you might. So during the menopausal transition, the body's production of estrogen from the ovaries and to a degree progesterone, the two main hormones made by the ovaries, decline until they're no longer produced. And changes in these hormones may explain the symptoms that some women experience during this time. And I will go into the myriad of symptoms in part 2. It needs a whole part of its own. So with all of these variables, how do you know if yours is arriving? It may be difficult for you to tell whether you're in the perimenopause period. Essentially, the diagnosis and how it is arrived at depends on your age. If you're under 45, then the doctor may well want to do blood tests where they look at your female hormones, including follicle stimulating hormone or FSH, luteinizing hormone or LH, estradiol, SHBG and testosterone. FSH and LH slowly go up as you get closer to menopause, and this is because the job of FSH is to stimulate the ovaries to mature an egg and for LH to tell it to release an egg each month. As those eggs get scarcer and older and of poorer quality, the brain has to release more FSH and LH to tell their ovaries to do their job. So they start to go up when it becomes harder for the ovaries and they reach levels that eventually are classified as postmenopausal. Estrogen and testosterone also start to get lower in perimenopause, and symptoms will arrive as these two crucial hormones drop. So these are the first step in diagnosing perimenopause in women under 45. In women over 45, blood tests are not recommended. Don't panic. It's not because you've missed your chance to get a diagnosis and treatment if you need it. It's because once over 45, most women are perimenopausal, and because things are all getting harder with your aging ovaries having to really put their elbow to the grindstone and get an egg out, hormones start to fluctuate from normal to abnormal, sometimes hour by hour, certainly day by day. So testing is like playing Russian roulette with a blood test. If you happen to take the test at a point where everything has returned to normal, but you have clear symptoms and that blood test comes back normal, it's not only unhelpful, it actually then sometimes stops doctors doing what they think they should do. Doctors sometimes love to be guided by a test result rather than their brain. I know, but if you'd have spoken to the women who've come to me after banging their head up that brick wall for ages, you would understand why I say that. So under 45, sensible to check hormones and make sure that there's nothing else which could be causing similar symptoms. For example, hypothyroidism causes very similar symptoms. Having said this, if I have a woman under 45 really suffering and I've ruled out everything else that might be responsible for her symptoms, I may, with her, discuss a trial of treatment of HRT. In women of 45 and over, it's what we call a clinical diagnosis. A good doctor will take a thorough history and correlate age and symptoms to a diagnosis of perimenopause and discuss treatment options if desired with you. So that's what a good doctor should be doing. It's also important to remember that however erratic your periods, until you're actually menopausal, you can still get pregnant. And if that is not desirable, for me it would be wonderful, but for many women not, then contraception is still a must. And trust me, I've seen women get pregnant at 50 on HRT. So in summary, every woman will go through menopause. The timing of that may be predictable by looking at genetics, but how you experience it is as unique as you are, and the approach to treating anything that you want treated should be similarly unique. Menopause between 40 and 45 is considered early, and anything below 40 premature. Some women get no symptoms and are completely disabled by them, and there are around 40 different symptoms, some common, some not so. So see part 2, where I will go over all of these symptoms and explain them. I hope that helps, guys. Take care.